Alright, how are you guys doing?
Hey, we're
good. Just fun. You feel like you're ready to go home?
Yeah, I think so.
What do we do about reflux?
Make sure she's sitting upright for about an hour.
Alright.
I'm going to go over a couple of things with you guys before I send you home. First, I'll just go over all the stuff from mom. Diet. Adequate nutrition is good for your body to heal, and you should eat foods high in fiber, which include bran, broccoli, cauliflower, and fruits to help your bowel movements become regular. Eat foods rich in calcium, which includes like dark green leafy vegetables, milk and yogurt. Drink plenty of water and non-sugary supplement and juices each day to satisfy your thirst and maintain hydration. Avoid soft drinks, coffee, tea, and alcoholic beverages.
No alcohol.
Okay.
You'll have to help me with my water.
Yeah, and make sure your water bottles are clean. It's important too.
Okay.
Activity. Gradually increase your daily activities until you are back to your normal routine. Rest frequently. No lifting, pushing, or pulling the first 2 to 6 weeks or as instructed by your physician. Do not drive until you're released by your physician. So Dad, you may have to help her out a little bit here. Breast care. Your breasts and nipples may have changed and or grown in size during your pregnancy. Wearing a well-fitted, supportive bra day and night may be more comfortable as your body adjusts to these changes. Wear breast pads until your breasts stop leaking. Leaking may occur several weeks to months. You may apply ice packs between feedings to ease the comfort. If you weren't breastfeeding or you decide not to, make sure you wear a well-fitted supportive bra for at least 3 to 4 days following delivery. Refrain from stimulating the breasts and nipples. Don't pump breast milk or permit the newborn to suckle to alleviate engorgement, because if you pump once or the baby sucks once, then it's going to continue adding to the supply. Apply cold compresses in the form of a frozen wet towel, cold packs or ice packs for 13 minutes at a time, every hour as needed. To prevent tissue injury, do not apply cold directly to the bare skin. Do not massage or apply heat to the breasts. Breastfeeding tips. Your baby's mouth should form a tight seal. The lip should be against the areola, not the nipple. If the baby is suckling correctly, slide a finger between your baby's lips and your breasts to break the suction gently. Reposition and try again. How long should you nurse? As long as your baby wants, usually 10 to 30 minutes. At first, your newborn will probably want to nurse many times in a 24-hour period, though it's usually not for very long if they want to be nursing. It is important for the health of your breasts to have your infant feed from both breasts every feeding. Good signs of nursing. You hear your baby swallow without a clicking sound. Seeing movement above the baby's ears. The ears may even wiggle. And not seeing dimples in your baby's cheeks. You and the baby should appear calm and relaxed during the feeding. You should feel gentle tugging at the nipple, but no pain after the first few times. If you do feel pain, it may mean the baby is not positioned properly or that the tongue does not extend past the lower jaw. Remove the baby and begin again. Hygiene. Wash your hands frequently as you're caring for yourself. To prevent infection, always wipe front to back after going to the toilet and clean your bottom with warm tap water using the Perry bottle. After you urinate or have bowel movement, it's important that you change your pad frequently. For bleeding, vaginal flow would decrease in amount from bright red to pinkish or brown to yellow or cream color. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. Bowel movements. Avoid constipation. You may take a mild laxative or stool softener until bowel movements have returned to your normal pattern. Increase fluid and fiber in your diet. That usually gets the bowels going again too. Birth control. You can discuss birth control options with your healthcare provider.
We do an FP.
Okay.
Or Catholic.
Okay. Good. I'll let you, you talk to your provider about that.
Okay.
Sexual activity, nothing should go into the vagina the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped and the woman feels physically and emotionally
Okay.
ready. Warning signs to report to your healthcare provider immediately. Pain, redness, warmth, swelling, drainage, or foul-smelling discharge from the incision, or if the incision opens. That's for like a perineal laceration or if you have a C-section. Discharge from the vagina that has a bad odor. Severe headache or blurred vision or visual changes. Temperature over 100.4, or if you feel cold or feverish or have chills, thoughts of harming yourself or your baby. Pain or burning sensation, redness, warmth, or swelling in the legs. Breasts that are painful, swollen, hot, tight, itchy, or have sore spots with redness or streaks and flu-like symptoms.
Mm-hmm.
Sharp pains in your... What is that?
Mastitis.
Oh.
Yeah, those could be symptoms of mastitis.
Yeah.
Okay.
Yeah, I think so.
Fever and all that.
Sharp pains in your abdomen, breasts, or chest. Trouble breathing, dizziness, or faintness. Crying spells or mood swings that feel out of control. If you're unable to empty your bladder or urination that is painful, difficult, or too frequent. If you have difficulty having a bowel movement, you should also talk to your doctor about that. If there are any issues of domestic violence or abuse, please call 1-800-96-ABUSE. And for the infant, baby Hope. Sleeping. Yeah. Please place your infant on his or her back to sleep. Use sleep clothing such as a one-piece sleeper instead of a blanket. Do not let anyone smoke around your infant. Use a firm mattress and a safety-approved crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for a sleep routine. Or for a routine sleep, sorry. Do not use pillows, blankets, or pillow-like bumpers in your infant's sleep area. Wedges and positioners should not be used. Keep soft objects, stuffed toys, and loose bedding out of your infant's sleep area. The baby should sleep in the same room as the parents, but not in the same bed. Avoid covering the infant's head or overheating. So you guys, you'll go home with a bulb syringe. Keep the bulb syringe near the infant at all times to clear the infant's throat or nose if necessary. You want to clean the bulb syringe with warm soapy water after each use, and then allow it to air dry. Hand washing. Always wash your hands before handling baby. Car seat. All infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to state laws. Home. The use of outdoor announcements is not recommended to announce the birth because they call attention to the presence of a new infant in the home. You should always question any unfamiliar person visiting your home or inquiring about your baby after discharge. Do not use home monitors or commercial devices marketed to reduce the risk of SIDS. It's just not safe. Behavior. Crying is a normal response for your infant. The most likely causes for crying are hunger, need for a diaper change, or needing to burp. You should burp your baby after each feed. Calming techniques. Calming techniques include feeding your infant, changing the diaper, gently rubbing the back or tummy, walking with your infant, rocking your infant, skin-to-skin contact, or giving your baby a pacifier. It's never okay to shake your baby. If you get frustrated or angry, put your infant in a safe place, take a break, and call a friend or a sister. Sleep patterns. Infants require a lot of sleep. You should be walking your baby at least every 3 to 4 hours for feeding. You should place your baby on his or her tummy each day for supervised tummy time. This strengthens her neck and abdomen. As far as your baby's diet, breastfeeding, your baby should breastfeed 8 to 10 times per day per infant cues. So when she's telling you that she wants to feed. Positioning, be sure to hold your infant close to you while feeding. Your baby needs to be cuddled and skin to skin time is recommended.
Do some more skin to skin.
Yeah. After feeding, hold your baby upright over your shoulder while gently patting or rubbing her back to burp. Formula feeding. Your baby is receiving a Similac or Enfamil diet. If your baby sleeps longer than 4 to 5 hours and misses feeding, wake them up to feed. Your infant will generally take 2 to 3 ounces per feeding after the first few days of life and will need to eat every 3 to 4 hours. Positioning, be sure to hold your infant close to you while feeding. Infant needs to be cuddled. Never prop your infant's bottle to feed. Burping. Infants need to be burped every ½ ounce of formula. After feeding, hold your infant upright over your shoulder while gently patting or rubbing her back to burp. More about just things that are normal characteristics. The newborn rash.
Oh.
It's normal for your infant to develop a rash on his or her skin. It appears with small red circular areas with a white dot in the middle.
White dot in the middle. Okay. She had a little red spot. I was wondering if that's what it was.
Oh, maybe. This doesn't require treatment and will generally resolve within the first week of life. Avoid lotions, powders, and perfumed soaps. Milia. Milia are white pearly bumps, usually on the face, especially the nose. They will disappear within the first week of life. Jaundice. Jaundice is a common occurrence in newborns. Your infant may appear to have a yellow coloring to her skin. It will start in the face and progress down to the toes. If your baby appears more yellow in the next 24 hours, you need to call your healthcare provider immediately. Infant care. Bathing. Your infant will need to be sponge bathed until the umbilical cord falls off. Using a soft washcloth or plain water, gently wash your infant's face. Bathe your baby from head to toe, saving the diaper area for last. Mild infant type soap may be used on your infant's body. And cord care. Keep the umbilical cord clean and dry. Cleanse with warm water and soap when soiled. Inspect the cord and surrounding skin with a diaper change. And notify the pediatrician if drainage or discoloration is noted. The umbilical cord will generally fall off within the first 2 weeks of life.
Is that normal?
I think so. That was good. Wet and dirty diapers. 1 to 2 wet diapers are normal for the first day or 2 of life. Then you should expect to have 6 to 8 wet diapers of pale urine every day. For the next few days, your infant's bowel movements will begin to change from a yellow-green to a mustard yellow and will soften in consistency. Your infant should have at least 1 bowel movement every 24 hours. You may want to keep a record of your infant's wet and dirty diapers to monitor adequate elimination and hydration. Genitalia. Female, always wipe front to back. Be sure to cleanse all creases and folds to prevent diaper rash. Pat dry and then put a diaper on her. It's normal for baby girls to have white or pinkish discharge. The secretions are normal and will gradually disappear.
I'm talking about you. I'm talking about you.
Hi.
Okay, you can go back to sleep.
And dress your infant as you would yourself. Avoid overdressing her. Too much clothing, too many blankets can overheat them, and it's just uncomfortable. And vaccines, they should get all recommended vaccinations. Do you guys have any questions for me?
No, that was super helpful. I learned a lot.
Thank you.
I'm so glad. Good luck with everything, guys.
Thank you.
The baby, you guys did awesome. You're gonna be great parents.
Thank you.
You were so helpful. I really appreciate it.
Anytime. All right, we'll see you for baby number 3.
Maybe.